Spinal fusion is a surgical procedure used to treat various back problems. It involves permanently joining two or more vertebrae in the spine. This fusion eliminates motion between the vertebrae, stabilizing the spine and reducing pain. Spinal fusion is a major surgery and is typically recommended when conservative treatments have failed to provide relief. The goal of spinal fusion is to relieve back pain, improve spinal stability, and correct any deformities. It is often considered for conditions that affect the integrity and alignment of the spine. Spinal fusion surgery is a complex procedure that requires careful consideration and discussion with a qualified healthcare professional. The decision to proceed with spinal fusion should be made collaboratively between the patient, their family, and the medical team. Factors such as the patient's overall health, the severity of their condition, and their individual needs and goals will all be taken into account. Spinal fusion is commonly used to treat a range of spinal conditions. One such condition is degenerative disc disease, where the discs that cushion the vertebrae wear down over time. This can lead to pain, instability, and nerve compression. Spinal fusion can help to stabilize the spine and alleviate these symptoms. Another condition treated with spinal fusion is spondylolisthesis, a condition where one vertebra slips forward over the one below it. This can cause pain, numbness, and weakness in the legs. Spinal fusion can help to correct the alignment of the spine and prevent further slippage. Spinal stenosis, a narrowing of the spinal canal that can compress the spinal cord and nerves, is another condition that may benefit from spinal fusion. By fusing the vertebrae, the procedure can help to create more space within the spinal canal and relieve pressure on the nerves. In addition to these conditions, spinal fusion may also be recommended for spinal fractures, tumors, infections, and scoliosis, a sideways curvature of the spine. Spinal fusion is a major surgical procedure that typically involves a hospital stay of several days. Before the surgery, patients will undergo a thorough medical evaluation, including a physical exam, imaging tests, and blood work. The procedure is performed under general anesthesia, meaning the patient will be asleep throughout the surgery. During the surgery, the surgeon will make an incision in the back to access the spine. The specific surgical approach will depend on the location of the fusion and the surgeon's preference. Once the spine is exposed, the surgeon will prepare the vertebrae to be fused. This may involve removing damaged bone or disc material. Next, bone graft material is placed between the vertebrae to be fused. This bone graft can be taken from the patient's own body, known as an autograft, or from a donor, known as an allograft. The bone graft acts as a scaffold, promoting the growth of new bone between the vertebrae. To further stabilize the spine and promote fusion, the surgeon may use metal implants such as rods, plates, or screws. These implants help to hold the vertebrae in place while the bone graft heals. Section 4. Recovery and rehabilitation. Following spinal fusion surgery, patients will need to follow a structured recovery and rehabilitation program. The initial recovery period typically involves a hospital stay of several days. During this time, pain medication will be provided and patients will gradually begin to mobilize with assistance. Once discharged from the hospital, patients will need to continue their recovery at home. This includes gradually increasing their activity level, following a prescribed exercise program, and taking pain medication as needed. The recovery process can be lengthy, and it's important for patients to be patient and follow their surgeon's instructions carefully. Physical therapy plays a crucial role in rehabilitation after spinal fusion surgery. A physical therapist will work with the patient to improve their strength, flexibility, and range of motion. They will also teach the patient proper posture and body mechanics to protect their spine. Section 5. Benefits, risks, and considerations. Spinal fusion surgery can provide significant benefits for patients suffering from debilitating back pain and spinal instability. By fusing the vertebrae, the procedure can alleviate pain, improve spinal stability, and correct deformities. This can lead to improved mobility, function, and quality of life. However, like any surgical procedure, spinal fusion surgery carries potential risks and complications. These can include infection, bleeding, nerve damage, pain at the bone graft site, and failure of the fusion to heal properly. It's important for patients to be aware of these risks and discuss them thoroughly with their surgeon. Spinal fusion surgery is a major decision that should not be taken lightly. Patients should carefully weigh the potential benefits against the risks and consider all other treatment options before proceeding with surgery. It's essential to consult with a qualified healthcare professional to determine if spinal fusion is the right treatment option.